Hi, this is our group, and we are talking about the impacts of the appointments of reminders for healthcare attendance. This is Nike.
This is Sule.
This is Rahab.
And this is Jennifer.
Next slide, please. The research question we chose for is that does sending patients appointment reminders via mobile phone, text messaging, and multimedia message service increase healthcare appointment attendance? The background of this one is that mobile text messages are a widely recognized communication method in societies, and systematically knowledge is still lacking on how mobile telephone text messaging has been used in healthcare services. Next step, please.
Our objective is to systematically evaluate recent systematic reviews to assess the impact of the SMS and MMS on healthcare appointment attendance for patients. For the rationale, the utilization of the mobile phones have been widely used recently. For the objective, we have several important reasons, like the ubiquity of mobile phones, enhancing healthcare access and efficiency, patient engagement and empowerment, existing systematic reviews, and continuous evolution of technology. Next, please.
This is our PICOs. The population here is the patients with healthcare appointment and interventions, SMS and MMS reminder. And the comparator here is no reminder service or phone call reminder. And the outcome is using SMS or MMS could increase patients' appointment attendance apparently. And our criteria here is patients who are 18 years or older, and the data method we use here is quantitative and qualitative or mixed method. And the keywords we use here is short message service, multiple messaging service, patient's appointment attendance, patient appointment non-attendance. Next slide, please. And this is our search strategy with our keyword and our flow chart. Next slide, please.
For the first article, mobile phone messaging reminders for attendance at healthcare appointments. Some details of the study, it concluded about 6,000 participants. It was conducted in different countries like Australia, China, Scotland. The settings of the study has varied, ranging from hospital health promotions to care clinics and governmental health clinics. Some insights gained, effect on attendance. The study showed moderate and low quality evidence that the SMS has increased healthcare appointment attendance. For the cost effectiveness, the included studies reported that text message reminders were more cost effective than phone call reminders. The user acceptance, it showed that 98% of patients were willing to receive routine mobile phone text message reminders. And another study showed that 87% of patients they would like the SMS program to continue. Potential harms, there was no harms or information about misreading or misinterpretation of the data. For the strengths and limitations, strength of a study includes a diverse range of settings and countries, improving the generalizability of the findings. It also conducted a comprehensive search for relevant studies, following rigorous inclusion criteria, and performed risk of bias assessment. For the limitation, most of included studies had unclear or inadequate blinding of outcome accessors, which might introduce bias. There was a high level of heterogeneity in the analysis, and the overall quality of evidence was moderate to low due to unclear risk of bias in several categories and small size sample. Next, please. For the conclusion, it concludes that there is a need for more high-quality research on the effects of mobile phone messaging reminders, while the available evidence suggests that text message reminders are effective and cost-efficient, but there are still some gaps in the aspects of the intervention. Further studies should explore the potential adverse effects and to address privacy concern to assess the long-term impact of the mobile phone text messages. These two figures shows one of them was with no reminder with SMS, and the second one was mobile phones with the SMS text messages. The one on the right shows that there was a high attendance rate at the healthcare appointments. Next, please.
The second article we chose is that using digital notifications to improve attendance in clinic, systematic review, and meta-analysis. The detail of the study is that it concludes 26 articles, and it also concludes from the Europe, Asia, Africa, Australia, and America, and it was similar accounting for risk of bias. The insight we gained from this one is can be the first one is effectiveness of received notifications. The second one is optimal frequency of notifications. The third one is the potential benefits for healthcare settings. The strengths, a comprehensive search strategy, a rigorous study quality, applied result assessing risk of bias, and the data synthesis in meta-analysis. The limitations of this one is that it's only conclude the study published in English, and it only includes that examine the effective of the text-based electronic notification on pre-scheduled appointment attendance in healthcare settings. And it doesn't provide information on the cost of effectiveness of the using digital notifications in healthcare settings. Next slide, please. From the figure 1 and figure 2, we can compare with it is that conclusion is that electronic text notification improve attendance and reduce no-shows across healthcare settings. It also suggests that sending multiple notifications could improve attendance further. And research suggests that future research should focus on the cost-effective of using digital notifications in healthcare settings. Additionally, further research could explore the potential benefits of using digital notifications. Next slide, please.
For the third article, it's about meta-analysis on the effect of text message reminder for HIV-related complaints. And in the review of the study, it's about the SMS reminder for HIV-related complaints. And in the studies, uses a lot of analysis and also statistical analysis to show the effectiveness of the SMS reminders. And the insights gained here is the effectiveness of the SMS reminders. There are 5 effectiveness. First is about the reduce the rates of non-attendance and increase the medication adherence and improvement of the physical measures and reduce the rates of the non-attendance and reduce the rates of high-risk sexual acts. And for the strengths and limitations, the strength for the study here is after a complete search strategy, and it's also use different kind of assessments, and it's also contain meta-analysis to reduce bias and give statistic calculations. And limitation here is a high rate of hydrogens in each analysis. And additionally, it's the same way to a random control trial and as a non-random control trial. Next slide, please. And for the conclusion part, the study include different types of analysis to show that SMS reminders improve the tendency of the healthcare appointment for HIV care, and it is also a very feasible way. And for the future research, it should pinpoint the population that gain most from these interventions, and it also should include the government or public health organizations for the text message reminder in clinics with low complaints. And these 2 figures shows the forest plot for the appointment of non-attendance meta-analysis and for the disease-specific non-attendance appointment. Next slide, please.
For our last article, it was using text message reminders in a healthcare services, a narrative literature review. This was a systematic literature review that was quite comprehensive. 196 potential full text articles were obtained, and then 162 articles ultimately that met the inclusion criteria was put into the review. The biggest key takeaway for the insights is that the review found 86% of appointment reminder studies and 85% of medical compliance reminders reported positive results with SMS messages. This reminders helped increase appointment attendance before appointment cancellations and decrease missed appointments as well. A big strength of this study is that it encompasses several diverse sources and different environments, disease-specific and not disease-specific healthcare settings, and also an international lens as well. A limitation of the study is that The findings from this review cannot be used to recommend a specific preferred strategy for the use of SMS in healthcare settings due to different methods and rigor which might impacted the results and biases in the interpretation of the review. Lastly, the findings for the use of SMS in healthcare treatment are quite promising. There is a rapidly increasing amount of literature that shows SMS reminders demonstrate value, improving prospective memory and supplementing behavior changes or interventions for these patients that want to show up to their appointments. This figure 1 shows that how each study was broken down by their respective size, design, intervention goals, and messaging frequency in the review. Overall, this literature review showed that SMS reminders are quite effective in increasing healthcare attendance and compliance. Decreasing no-show attendance rates helps positively impact healthcare outcomes and potentially patient satisfaction as well. Moving forward, privacy issues may also be a barrier as the healthcare landscape leans more digital. That is the end of our presentation. Thank you so much.